I've come across to talk to Dr Hilary because there's a warning about breast screening this morning. Hilary, this is really concerning. Now, on one hand, we say 70% of women, eligible women, are taking up their appointments, their screenings. Yep. Great news, until you realise 30% are not.
Exactly.
It's a worry, right?
Yeah, we know that a third of women are not going for their first screening, and those who don't go for their first screening often don't attend for subsequent screenings. Right. So a third of women are not having breast screening. Now, breast screening saves lives. We reckon it saves about 1,300 lives every year.
Incredible.
So it's really important to go along when you're invited. You will be invited between the age of 50 and 71. The latest you'll be invited will be the age of 53, and you'll be invited on a regular basis to get those screenings done. And the benefit of screening, as you know, is that it'll pick up abnormalities before you can feel a lump. Yeah. Still important to do your self-checking, and we'll constantly remind people in our Change and Check campaign how to do that well, and that's important too. But breast screening can find things earlier than self-examination. So we really want those other third of women to accept that invitation. Go along, get it done. Don't be frightened of the results, because early detection means a much better outcome, better chance of survival.
We're so lucky that we get the opportunity to do that. So many countries where people just don't get the opportunity, women don't get the opportunity to do that. So it is really, really important. And I guess we have to try and find out the reasons why. You know, there is that thing with women putting themselves at the bottom of a big, long list.
That's right.
Prioritise.
Yeah, that's right. Put other people first, not yourself. But also a little bit of fear about the result. You know, what if? But, you know, better to find out and get it treated. Because there's a good chance of a cure if you get it, diagnosed at the easy stage.
It's easy peasy.
It's easy.
It's not a difficult one to do.
It's not.
And not at all.
Absolutely. And they're going to be very sympathetic, and they see women all the time, of course. Sure. So it's relatively easy. Get it done.
Absolutely. Listen to Dr Hilary. He knows things. Now, look, beta blockers for anxiety, because we've been hearing a lot about people in Hollywood as well, the anxious lives they lead. But they have been talking a lot more about using them maybe for, like, the red carpet, for award ceremonies, for making speeches.
No, it's peculiar, because beta blockers have been around for years. Years and years and years. This is nothing new. It's a bit like Gen Z telling us they've discovered sex when we know they haven't, and they're getting less sex, according to recent data, than the grandparents are. Anyway, I digress. It's nothing new. Robert Downey Jr., who's talked about it, and Kristen Bell are talking about the wonders of beta blockers for performance anxiety. We've always used it for that. So if you're sort of got a fear of flying, for example, or you're giving an after-dinner speech and you get all those physical manifestations of anxiety, like butterflies in your stomach, a dry mouth, palpitations, sweating and a tremor, that's adrenaline doing that. Right. Now, beta blockers stop the response to adrenaline, the physical response, but it doesn't affect your ability to think. So you can deliver your speech without the sedation that you might get with other things like Valium and other anxiolytics that people might use. So it's useful for that. Traditionally, it's been used to control palpitations, abnormal heart rhythms, an overactive thyroid, migraines as well. We'll come on to that in a moment. But it has this effect of allaying anxiety. But in the short term, you don't necessarily want to take it long term. I was going to say, that would be good. But as a one-off, say you're making a speech at your daughter's wedding. Exactly. And you're terrified, and that is a hard thing to do. Or things like that, that's out of your comfort zone. It'll stop all that shaking,
but you wouldn't be wanting to do this. For example, we saw Katy Perry there. If you're a singer or an actor or someone like that, you don't want to be taking that every day because that's not addressing the root cause of anxiety.
Better to learn to cope with the anxiety and deal with it, coping mechanisms, than to take medication, of course.
But for a wee, just for a wee help, then it's not a bad thing.
Exactly.
You mentioned that it could help migraines.
Yeah, just to add, it shouldn't be used people with asthma or respiratory conditions, and it can make your peripheries very cold, so worse than if you've got Raynaud's condition.
Oh, don't do that then.
So don't take beta blockers. Anyway, just a word of warning there. Yeah, migraines. So propranolol has been used as a preventative for migraines. Now, it's Migraine Awareness Week, as it happens, and there are about 10 million people in the country who suffer from migraines, with the nausea and the headache, usually the one-sided headache. Nasty, and about 8% of people get it chronically, so on a regular basis. Now, there are lots of ways of dealing with it. You can take your paracetamol or your ibuprofen as a first instance. You can avoid the trigger factors that you know causes it for you, because everyone's unique. Everyone will have different trigger factors. But there are also other medications like triptans and devices, so cold wraps that you can wear around your head. You put that in the fridge, put it on your head.
Does that work?
And that can help some people.
OK.
As I say, everybody's
that's the
different.
Thing, that's the horrible thing about migraine, isn't it? There's not a cure-all because
There's no
every
cure-all.
single person has different symptoms and a different
Much more common in women as well, 2 to 3 times more common in women. And there are lots of devices on the market. This is just one example. This is called an Irivio. This is worn on the upper arm. And what it does, it's controlled by your smartphone, an app on your smartphone, and you can deliver remote electrical signals, and this is called neuromodulation. So this stimulates receptors, nerves under the skin, which sends signals, pain-relieving signals to the brainstem where the migraine is initiated in the first place. So for some people, this might be worth a try. For other people, it'll be medications. For other people, it'll be avoidance of the triggers. There's always something you can do. And Botox is another one. Botulinum toxin is injected across the top of the head, forehead, right to the back, and other injections to block those nerves, which can cause the migraine in the first place.
And with that sort of device, I guess there's no side effects then with that?
No, exactly.
No,
this is non-invasive. It's not a medication, no side effects. So lots of things to choose from, and there's plenty of information available on the web.
Horrible thing to have to deal with that.
It is.
Really ghastly.
I've only had 2 migraines in my life, and I don't want another one.
No, you absolutely don't. Hilary, thank you very much indeed.
Looking for more health and wellness content? Well, there's plenty more really useful information right here on our channel. How about you check out this one?